All right, this is Dr. Stewart from Timonium Foot and Ankle Center. We are looking at a foot here where we did some surgery, and I'm going to show you the x-rays. We did a fusion of this big toe joint. This is the first metatarsal phalangeal joint for a condition called hallux rigidus or hallux limitus. We did a fusion of the second toe. We did something called a wial osteotomy where we shorten this. And we also did up here a calf release, which we don't need to really see that incision, somewhere over here, okay? This patient is with me today, and you're a runner, correct?
Yes.
And prior to doing the surgery, your running was very painful for several days afterwards, you said, right?
Yes.
Yeah. When he first came in to see me, he had a ton of pain in this joint here. Like when I went like that, I mean, if I just simply did that lightly, he was jumping off the table and hitting the ceiling. When we moved this joint here, it was a lot of grinding and crepitus to this joint. I'm sharing this video today because this gentleman is a runner and he really wanted to get back to running. And a lot of people always ask the question of how will I function after I have a fusion of my joint? That scares me. Can I run? Can I be active? And let me just show you surgically what we did. We took this joint and we put a screw across the joint. We brought these two bones together. We put a screw here. We essentially shortened this bone here. This bone was longer and this reduced his pain here. And we put a wire in the toe and the toe is now straight. He's gotten partial bony consolidation of the toe, but the toe does not move at this site. So at the end of the day, we want to answer the question of, have you been able to get back to running? And before you answer that, I did tell you it would take a solid year to make a full recovery on this surgery. So give us some information.
Yeah, well, it definitely took a year before I got back into running. And it was, the surgery definitely changed my gait. My gait prior to running, I was rolling off the side of my foot, which was causing hip issues. Now, after the surgery, I've got a better gait. What it has done is it has put a little bit more pressure on the tip of my toe, but that's just a matter of getting used to running again.
How's the pain with running?
I'm not in any pain with running.
What type of distance are you running and how many days a week?
I'm running probably about 3 to 5 miles per day, and just completed a half marathon 5 days ago.
Okay, so this is proof in the pudding that you can get back to activity. This gentleman, is phenomenally fit. He's a 62-year-old gentleman who is in phenomenal shape, and he is back to running after a fusion. So for everybody who wants to know, can I play golf? Can I play tennis? Can I do this? Can I do that? The answer is yes. The reason before surgery he was having pain on the lateral aspect of the foot where you said he was rolling is he was avoiding weight bearing here. So he was walking like this. Now his gait is normal. And as a natural consequence of this surgery, you don't have motion here. You have to make up for motion here. So he's inherently going to push a little bit more off of this toe. And the one thing that we do warn patients is that they can get some callus here, which he actually has a bit of callus right here on that foot. And they can also get some ingrown toenails. But he's avoided that. So this is a great successful case of showing how a fusion of the big toe joint can be successfully treated, and we can maintain a high level, and I'll repeat that, a high level of physical activity down the line. This is Dr. Stewart at Timonium Foot and Ankle Center. To learn more about foot injuries, arthritis, and anything about the foot and ankle, give us a call. Thanks.